Good morning, everyone. Welcome to our presentation for the Strategic Plan Evaluation of Change Initiative for World-Class Patient Experience. My name is MJ Apolonio, and I'm going to present to you our objectives at this time. Thank you for coming. First, why do we need change for our patient experience? We will also describe how to use the PDCA model, which stands for Plan, Do, Check, and Act, that we can operatively use for the change in patient experience initiatives. We will describe our methods to evaluate the need for change and discuss how to identify the right individuals for our guiding team. We will also explain how to deliver clear and consistent message to our stakeholders so that we will all be aligned on the ways on how we engage our stakeholders. We will assess the implementation initiatives and we will evaluate sustainability of change strategies. We will align everything with our mission. We extend God's care through the ministry of physical, mental, and spiritual healing. And we will align our behaviors through our RISE's values, which stands for respect, integrity, service, excellence, and stewardship. In order for us to maintain our vision to be the regional leader of our 6 pillars for excellence by 2022. So why? Why do we need this change? Because we have a suboptimal patient experience results through the nurse communication domain on our HCAP scores, which stands for Hospital Consumer Assessment of Healthcare Providers and Systems that are not meeting our target. This is not acceptable because not meeting the target means that we are not receiving any incentive payments through quality-based reimbursement or our QBR for our organization. So with this need for change, our expected benefit is to be able to improve our nurse communication domain to meet the target or world-class patient score for improving our patient experience in order for us to receive payment through QBR. You see that smiling face? This is where we will be in our next surveys in the incoming months. With this concept, we will now do a roadmap. Do you have any questions at this time? Thank you. So our roadmap will stand for P for plan. There is a need for change. Yes, we will move on to P. We will create our plan by creating a vision and analyzing our data and build patient experience teams. And this will include our patient experience manager, a quality data person that will be looking at our domain to meet our quarterly 90 percentile benchmark nationally for our patient experience scores. Then we will do. Doing is implementing our patient care initiatives. And we will see for check, assess our patient experience effectiveness, and then act to be able to standardize patient experience best practices of our initiatives. And if this won't bring us to the delivery of world-class patient experience results, we will then go back and continue to assess our initiatives, which are assessing our patient experience score on the nurse communication by looking at how effective our nurse communication techniques, both verbal and nonverbal, our tone of voice, our body language, our facial expression, how we bring forth ourselves to our patients. And then we will make sure that we are doing our bedside shift report and using the whiteboard to communicate our patient's plan of care and be able to then have our patients ready for education and be able to teach back to us with what they learn from us. This is all how we will assess and evaluate our patient scores and nurse communication domain, following up ineffective nurse communication techniques, as I said, both verbal and nonverbals. We will go with our extending God's care by bridging the gap framework. G, that stands for greeting everyone by their name. A, for anticipating their needs and exceeding their expectations, as well as P, for preparing our patients for what's next. We will disseminate this information through our monthly meetings on patient experience, our daily huddles, our unit-based council meetings, as the voice of our stakeholders to gather more information and feedback from our stakeholders, as well as going to our shared point patient experience site on our intranet of the Adventist healthcare intranet information, tools, and resources. With this being said, we will be able to monitor better our regulatory drivers, external driver, which is our regulatory standards or patient experience, and having the quality of patient experience results tied to our financial initiatives so that the Hospital Consumer Assessment of Healthcare Providers and Systems, or HCAPS, and CMS will be able to give us our incentives through a great survey. Our internal drivers of the inconsistency of our standards will be streamlined and aligned on our processes by updating our whiteboards and well defining them and hardwiring them, and talking one-on-one and coaching our bedside nurses and every customer and stakeholders to be able to be consistent with these initiatives. That being said, we will be able to excellently communicate and listen to our patients, as well as being able to then bring emails and newsletters in a timely manner. With this being said, we will receive our incentive payments for our patient experience from quality-based reimbursement, and describe how our vision of this world-class patient experience through our nurse communication had related to the organizational vision, mission, and values in delivering quality and safe care through world-class patient experience. Thank you for coming to our presentation, and good luck to our mission and our vision in extending God's care through world-class patient experience. Have a great day.